Hello, Heather. Thank you so much for joining us today.
Hello. Thank you so much for having me. I'm super excited to be here.
Yes, we have been looking forward to this for sure. So let's get started and just visit a little bit about what you do and how you got into fitness.
Well, it all started with Jane Fonda. I can even not. In second grade, we got to dress up as what we wanted to be when we grew up. And I dressed up as Jane Fonda, not for her political beliefs, but for her exercise and her help for helping people live a healthier life. So at that age, even I knew I wanted to help people with their health and movement, and that was really important to me. They, I was sick as a child, and so I think I saw the value in what that brings into a life or doesn't bring into a life if you don't have it. So that's kind of early on how that started. And at that point, then, as I grew up, I went to school for health and exercise science. And at the time, I was working for a private investigator, and I actually continued to work for her after because it's hard. Way back, everybody didn't have a personal trainer. It was very personal trainer. And so I eventually started doing my personal training kind of on the side and then went back and got my yoga certifications and myofascial release, all kinds of things. And then most recently, functional nutrition counselor.
Excellent.
Yeah.
Yeah, when everybody thinks of Jane Fonda, you always think of the tights and the headbands and all. You gotta look the part, if you're gonna exercise. So
It was an easy thing to dress up as, especially in the 80s.
Yes.
Right.
Do you remember there was a product I was called Get in Shape Girl?
No.
Oh my gosh.
Tell me about it.
So it was just for kids, for girls. I mean, this is kind of sad as I look back at it a little bit, but they were like dumbbells and a headband and wristbands. And it was called Get in Shape Girl. And you could get it at like the toy store or
No.
yes, I will have to say I have some pictures of me.
Yeah.
We're about to see those. We'll post those, I'm sure.
Yes, so I'll have to share those with you. But when you
Were they really weights or were they plastic weights?
they were plastic, but they were like
They look
little
like-
dumbbells.
Oh my
Funny.
gosh.
And I was not like you. Like I didn't understand the power of fitness then. Like
Right.
so it's
Really?
kind of
Importance
funny.
of exercise.
But now you get it
Right. Now I get it.
in time. So cool.
Says, speaking of walking into gyms, what do you think? So what's a real common misconception that people will have in maybe their 40s, 50s, midlife, when they walk into a gym? What's their misconceptions of what they think is going to happen in there?
I think the biggest one that I see is that they want to go in and they want to go on the treadmill hard for an hour and then eat less, no weightlifting, no stretching, none of that stuff. It's just all cardio all the time, which as we know isn't adequate. We need the weightlifting, we need all the other things. So you see a lot of people, especially starting in that mid 30s up, that just go in and they're like, I spent an hour on the treadmill every single day and I didn't see any improvement in my clothes fitting better, my scale, or, any of that. So,
Yeah. It's all about caloric expense. They're trying to just burn calories.
right. Which is what we've been taught. I mean, the 90s, that's what it was all about, right?
Sure.
Well,
And for a lot of people that works when you're younger.
Mhm.
You can do those things and it does provide some results.
Right.
Yep. And pretty fast, most of the time. But as we get older, not so much. I mean, if you think about it, well, I mean, you don't have to think about it. We know our muscles are our longevity organ. And by just getting on the treadmill, you're not building the muscle. So
Right.
we need that.
Yeah, it's all about that. So speaking of which, how does the training differ? You got a 25-year-old that can walk into a gym their first day, and you got a 50-year-old that walks in the first day. What's the differences? What do you think that training program should look like, or how does that differ between those two groups?
recovery is definitely more important as we age. And we definitely need more time in that recovery and more of it. So more stretching, more of the work that goes on behind the scenes, not just the flashy weightlifting and stuff like that. And then also I've seen a lot of change where, somebody in their 20s, they can come in and they can do 3-pound weights and burn out the muscle, and they can see improvements in their muscle. But as we get older, that doesn't cut it anymore. We need that extra load. We need that progressive weight to help push our muscles harder. They need more. They need more from us.
Yeah, it's all about adaptation. You got to get that adaptation going and stimulate that. So
So let's dig into that a little bit. So and because I think that there are a lot of people in midlife who fitness was not at a priority for them. And so they're coming into midlife and now they're trying to get into this. And so what does an effective muscle building program look like for someone who hasn't ever been in a gym?
Yeah. Well, one thing that we need to remember for people who haven't ever lifted or they're just starting to lift after a long time of not is that heavy looks different for everyone. So making sure that you're not challenging yourself against somebody who's been in the gym lifting weights for the last 10 years, because that's going to look very different for you. So making sure that you find the right weight to start with and not just, well, I used to lift 20 pounds, so I'm just going to go back to that. And then the next day you can't lift your arms at all. There's that balance. So making sure, one, that you find the right weight whenever you're starting. And then also putting it in your schedule and really getting a good schedule of working out going, because it's so easy to go, oh, I'll just go once and lift really hard that day, and then I'll go again next week.
Yeah.
Well, you need that 2 or 3 times a week.
Okay. So 2 to 3 times a week is a good starting point.
Right.
Okay. Excellent.
Yeah. And focus on the move. Yeah.
Yeah. Funny story. I got to say this because it came to my mind, because when you talked about people just going in and hitting it hard, I did that when I was in residency. I was traveling and I decided, you know what, I'm going to go to the gym today and I'm going to work out and I'm going to start this routine. So I went in and with that same mindset, it's like, I used to lift like this in the past, so I'm going to start doing this now.
Yeah.
I did that night. I couldn't straighten my arms and I couldn't hardly feed myself for a week. And so it's like, oh my gosh, why did I do that? So, and I was young. So can't even imagine, now being older, starting that up. So
you had youth on your side at that point.
exactly. And so there's so many individuals that have this mindset that they have to start back heavy again, or they have to compare themselves to what the other people in the gym are doing. It's so intimidating for so many people. And I think that's some of a problem for individuals going or wanting to start back at a gym. Is just the intimidation process too, I think. So it's like, oh my gosh, you got to compare yourself to everybody. No, you need to be yourself and lift what you can lift. And it's a progressive thing. So it's not a going out the gates hard, it's not a sprint. So,
yeah. And I think one of the great things that I found about being in midlife is I don't really care what other people think, so it's easier to go into the gym now because I'm like, I don't care if you think that I'm not lifting heavy enough or working out hard enough for you.
Exactly. That is a true glimmer of midlife.
Yes. Yeah. Because I see that a lot too in my races. I take off running. All these young people, these 20s and 30-year-old folks, are just smoking me at the beginning.
Yeah.
And then at the end, when it gets about 20 miles into it, it's like I'm going right by them and they're hobbling. So it's like, okay, you see what happens when you kind of pace yourself.
You gotta work smarter.
Okay, so we've established that a good starting point is 2 to 3 times of strength training per week. Is there a sweet spot as far as the length of a strength training session?
If you're getting in a good amount of muscle groups while you're there, a 20 or 30-minute session can do a lot of work if you're getting in those major muscles. So you've got to kind of narrow down, what does that look like? So there are some exercises that work multiple muscles. And so kind of if you have a limited amount of time, really looking at, okay, I only have 30 minutes this time, so I'm going to really focus on getting the most muscles that I can in this amount of time.
Okay.
So kind of tweaking your workouts for that. Now, not every time, hopefully sometimes you'll have an hour, but really you could, if you needed to, put it in a 30-minute window.
Okay.
Yeah, because a lot of times the problem is not necessarily, you can get a person or an individual to the gym, but to have them sit there for an hour to try to do something on machines or weights or wait in line, that's frustrating. So,
It's hard. It's hard to wait in line and you're like, gosh, I could be doing so many other things.
yeah,
My time. Yeah.
I love that work and working multiple muscle groups at a time. There's a lot of activities and exercises. I'm really big on that too, about working, one activity works as a lot of different muscle groups. So, but what do you think that the main areas that we should work at or we should work on during these activities?
The back of the body, obviously, is really good. Anything that's going to protect your joints that are we've talked about the shoulder joints before. That's something that is such a flexible joint, which is great. It has so much mobility, which is awesome. But also that means it can get injured more easily. So making sure that we are working muscles to protect those joints, our knees, our shoulders, all of that. So like a deadlift, you're getting in a lot of pretty much the whole back chain of the body doing a deadlift. So that would be one that I would throw out there that's a big bang for your back is a deadlift. Chest or shoulder works, like a military press, just pressing up over the head. That's a great one because you're working the shoulders. You're also, if you drop it down a little, you can also get at those lats in there. So, you're getting multiple movements with that. So the other one would probably be the chest, making sure that that's worked. And then the legs. So squats, lunges, or even a bridge. If you've got knees that are like, I'm not doing a squat or a lunge, coming down onto the floor, modifying and doing a bridge. And then maybe eventually you could work up to doing a lunge or squats. But listening to your body is really important. Don't push something that you're like, gosh, my knee, it's kind of on the verge, but I'm going to go ahead and power through. Start where your body's at. Yeah.
And you can have injuries at any time even. I know I've worked out for years and years and years, and all of a sudden you can have a problem with the shoulders. Like you can't do those same exercises you used to do. You got to give it a break and let it heal up a little bit so you can move on. So.
Right. Yeah. And still, go ahead. I was going to say, but still maybe do other exercises. Don't just say, okay, I'm giving up, because an object in motion stays in motion. So we want to keep that consistency. But, if you've got an arm injury, then focus on the legs more and keep that time devoted to your workout so you don't slip into, oh, well, I used to work out every week and now I'm not at all. So
I love that tip. That is such a great tip, because I think so often we can use that as an excuse to say, oh, I'm injured, so I can't work out.
Take a few weeks off, and then a few weeks becomes months.
Yeah, and you just lose your momentum. I think that is one thing that oftentimes is a struggle, is just getting that momentum going. And when you have a setback like that, how do you, transition so that it isn't a setback? It's just you're redirecting.
Yeah. And I do have a lot of clients over the years that have had a broken ankle or shoulder surgery, and they are adamant. They're like, I'm not stopping. I'm still coming. Let's just figure out how to tweak this to where we can keep going and keep building the other parts of the body up a little bit more, maybe while I can't use this part. So
yeah. Yep. Just like, the worst thing you can do is nothing. Something is better than nothing.
Absolutely.
So you mentioned some great things, and I loved all of that. If there are people who haven't been doing this and just don't have the knowledge, where is a good place to find this information about what a move should actually look like? Or do you have any resources for people like that?
I did a whole series years ago. It's on YouTube and Vimeo, and it's like literally how to do a good proper deadlift, how to do a plank, how to modify those things if you need to, how to do a lunge, what to look for in that. Basically all the big movements that could have a little bit of, a deadlift, you could hurt your back if you're not doing it right, or a lunge, you could hurt your knees. So anything that could put stress on a body part, I did a whole series. I'll send that to you and maybe you can link it, because
Definitely.
it has been helpful for a lot of people. They've sent messages and said, thank you. I was doing this the whole time. I never knew why my knees hurt whenever I would do a squat, but now I know.
Yes, I love that, because I think people don't think about those things, that this really is, there's a lot of science to movement.
It is, yeah. There's a lot of physics.
Yes, exactly.
Yeah. But how do you explain progressive overload for maybe it's someone that's not really into the gym activity or the lingo? How do you explain or describe progressive overload?
It's the practice of just gradually asking your muscles to do a little bit more over time. So our bodies are very smart, as we know, and they adapt to whatever stress we put on it. And if we're lifting the same amount of reps, the same amount of sets over and over and over, then our body just gets comfortable with that and it just stops changing. So while you may be maintaining, it's not challenging for our bodies. So progressive overload is how you keep giving it a reason to grow. Kind of how I explain it usually to my clients is it's like reading. So you wouldn't hand a college textbook to a second grader and expect them to understand what's going on. You want to introduce it slowly to where they build up, and then, eventually they're reading that college book. Our muscles work the same way. So just
that is a great analogy. I love that.
So what do you think the biggest training mistake is for individuals of someone that's maybe just either they're starting out or maybe they've been lifting or working out activity wise for years? What do you think some of the bigger mistakes that people make?
I think it's kind of reverse for men and women. So
Okay.
a lot of times I see women and they're worried about weight a lot of times, not so much thinking about the muscle aspect of it. So, or they don't want to bulk up. That's something that I hear a lot. So for women, they don't usually like doing the weightlifting and things like that until they start doing it and then they enjoy it. But a lot of times, like, I don't want to do that. I don't want to bulk up, or I don't like doing that. I want to do Pilates and yoga, things like that make it lean. And then for men usually don't like the yoga and stretching, that part of it. They just want to lift the weights, the heavier, the better. So I most of the time, if there's something you don't enjoy doing, it's probably because doing it.
Yes.
So
True.
So listening to your body a bit, but also, whenever we get to be older, we want to be able to turn our heads. We want to be able to get out of the chair, get down on the floor, things like that. So think long term, not just about, building muscle or having a lean body. Like we want healthy structure is what we want.
So true. We talk about that a lot with patients about the workouts that we do. Are they going to protect us if we fall, or are they going to make us more stable so that we're not falling?
Right. What do you want to do when you're 80? Do you want to be in a wheelchair, or do you want to be functional up and moving and be protected? So,
and kind of looking back from that too, like think, okay, do I want to still be traveling and, hiking and doing all of that at 80? If I do, I should be doing it now.
Right.
Right.
It's never going to get easier than now.
Exactly.
Preparation.
Yes.
So let's talk specifically about women and help us understand what you've seen as you've kind of worked with women of all phases of life, and how you see things as they change through those phases, perimenopause, menopause.
It's so interesting because you can kind of almost see things stop working that they've been doing for years. It's just like almost they hit a wall. And so for women, it's really hard to kind of dial that back in and change the thought process of those things that have worked for so many years. And just also the programming that we've had over the years, you know, eat low calorie, don't eat carbs, all of that stuff that we've been told. It's just not, it's not building that healthy foundation. It's not the nutrients and the support that our body needs. So really a lot of it is in our mind that we have to change. That is my primary job that I deal with. I really have to help people change the way that they've looked at weight loss, which I don't even like that term. I tell my clients not even to weigh themselves. I'm like, don't do it. It's not healthy.
Right. Everybody looks at the big number. It's like not the big number. It's all the little parts that we're looking at. That's what we need to fix.
Kidding.
Yes. We have had people come in and be really frustrated because they've gained weight since the last time.
You know, they stay the same or gain a little bit of weight. Correct.
And then when we do a body composition, they've gained muscle. And I'm like,
they've lost fat and gained muscle.
We want this. Like,
keep it up.
Yeah. Yes. Muscle is good. And I mean, muscle takes up, I know a pound is a pound, but muscle takes up that space and it pulls things in. So you look totally different, but you could weigh more. You could be fitting into your clothes way better.
Exactly.
Way more on the scale. So yeah.
We really emphasize for the ladies in the perimenopause and the menopause age brackets to really focus on, you know, building muscle and maintaining and building bone, because you're going to lose it. If you don't see something, you're going to lose it. So it's something that has to be done.
Yeah. Rebounders. I use that a lot. The little trampolines, vibration plates. I use that a lot for balance and for the bones and muscles. Yoga and meditation for women, especially to calm the nervous system, because, you know, we're in that up and down roller coaster of hormones. So you may not even realize how intense you're feeling until you're not feeling that intense. So
exactly.
Yeah. And then for men, you know, I see the situation with maybe they have, you know, declining testosterone levels or, you know, suboptimal thyroid function, but we see a lot of with men, we see a lot of them having troubles with, you know, endurance or strength or motivation, you know, stamina, things like that too. Is that something you typically see with the men or in training?
Yes, absolutely. And in fact, I just had it magnified because I had a client that had prostate cancer and he was given the medication to get rid of his testosterone. And so I did tell him, I was like, well, now you know how we feel as women. He was complaining that he was sore after every workout. He's never been sore after a workout. And I was like, that is because you don't have testosterone there on your side helping you through these workouts. So, I mean, it's so important that they see people like you that can help them dial in. You know, testosterone for men is so important. It makes such a big difference.
Yeah. And I don't want to negate the fact that women need testosterone too. And it's equally as important. So I don't want to just single out the male population personally, but yes, women also, it's testosterone in any human being is going to be a very vital.
Yeah. Men just need more.
Yeah. And I do think that with men, and I don't think andropause gets talked about as often as perimenopause and menopause, but I think it's important to just even recognize that there is a thing and it is happening. It just happens at a much slower, steadier rate.
Yeah. Yeah. And have you guys talked a bit about that, like what andropause is and all of that on the podcast?
We have on some other podcasts, but yeah.
But that's certainly something that with the male population, we see a lot of that. And then they start getting the weight gain and they lose libido. And there's a lot of other issues metabolically that happen. So it's certainly a contributing factor that makes a big difference in their overall metabolic health in general.
Yeah.
So,
absolutely.
and then then you do that for a little while, then you start having cardiovascular problems, dementia, etc. So it's not something that it's not just about muscle. It's not just about gaining muscle or maintaining bone. There's a lot of other things that affects when we get older.
Yes.
Yeah.
Men and women.
Men and women.
Absolutely. I think for men, a lot of times, not to be rude, Mark, but more is better. A lot of times I see that, maybe you're different. But a lot of times they're like, oh, more is better. If 2 is good, I'm going to do 10,
Yeah.
So trying to think through like that.
Yeah.
It needs to be smarter, not necessarily higher or more.
Yes.
So
Exactly.
Do you find that men have a harder time with the recovery piece?
usually men recover faster, it seems like, but men have a harder time taking the time to recover, I would say.
Yeah.
Okay, yeah.
That's what I was wondering, if that was your experience, because I would imagine when we think more is better, we have maybe a harder time saying, oh, I better take this time to.
Yes. I have a few clients that we do push-up tests and a plank test like once a month.
Perfect.
And so I have one guy that's like, I just did my push-ups yesterday to see how many. And I was like, no, why did you do that? Like, you should go max push-ups 2 days in a row, like, oh no.
That is.
Yeah.
Yeah.
But I'm excited, it's good to be excited about it. So you just have to figure out that balance.
Yeah, we have a lot of patients and personal individuals that have a lot of trouble with that recovery piece.
Yeah.
They feel like, okay, I've got an extra amount of time. I need to go do a 5 or 10 mile run, or I need to go get on the bike for 20 or 30 miles or whatever. It's like, no, you've got to recover. You've got to heal. You've got to create that adaptation. And that recovery and sleep is vitally important for these individuals.
Yeah. And I mean, I see a lot of sleep changes for men in midlife as well. I don't know if you guys have noticed that.
Mhm.
And then you've got the cortisol and testosterone, like they have that inverse relationship. So for men and women, so you get high cortisol and then that suppresses the testosterone. And then you get into that cycle of, high stress, poor sleep. It's
All the things.
disaster. Yeah. Good. Not good.
With the difference in the genders, the men and the women, do you see that there's certain activities or exercises which they tend to work better or gravitate towards or become more successful with a program?
I don't treat women as like smaller men, but I do feel like it's really important to make sure that we are doing a lot of the same exercises, because like I want to lift my suitcase up over my head and put it in the bed and things like that. I can't really think of any on my side that it seems to be. I mean, I feel like we all really need both ends of the spectrum, from the stretching and the weights, the yoga, the mindfulness, all of that. I think it's a whole picture. So
Yeah.
whenever I train, it's usually a little different, but not much.
That's excellent.
Components are there.
Yeah, I like that.
So you talked a little bit about yoga and the meditation. What does mobility and flexibility, how does that play into strength training?
It's huge. I mean, one, just because you're getting the range of motion to work the muscle fully if you have the flexibility. So one, that aspect. Two, the recovery time is usually way better. You're way less sore if you've got the flexibility and you're doing the stretching. The mindfulness part of yoga and the meditation, that for me is where I see a lot of the best recovery for my clients, is if they're doing that, especially just a 5-minute meditation before bed, then they're sleeping well. And then we know sleep helps you recover. That's whenever you're repairing. So
Yes.
that key is locked in there too. So yeah, I would say that that's probably the most that I see.
Yeah, I think that that's something that gets overlooked a lot. So I appreciate that you weave those all together in your plan.
Yeah. So if a person has problems with injuries or activities, just say a history of injuries, maybe bad knees or problem with their back or shoulder problems, what do you think is the first approach that you would have to training somebody like that? What is the first thing that's either on your mind or something that needs to be put in the forefront whenever we're initiating this activity exercise program?
Well, first, making sure that that area is healed, that there's not some major issue going on with it. So if you rule out that, you don't have something broken or torn, that you shouldn't be doing an exercise in that area, then once you kind of get that ruled out, then start slow and light and work your way up. I mean, that progressive strength, progressive yoga, all of that, just whatever you're doing, start slow and light and work your way up. Especially men, that is so hard. I've worked with so many men who have shoulder injuries and things, and they just want to push through. And I'm like, no, that's actually the only client I've ever fired was a man who, I love him. He was awesome, but he was boxing and he was lifting heavy. He had a torn rotator cuff, and I was like, you have to stop. And he wouldn't. He couldn't.
Yeah.
Now he's had 4 shoulder surgeries because he wouldn't go light and slowly build it up. Like, you have to listen to your body at some point. You can't push through forever,
Yeah, it's going to catch up for sure.
And I think for some individuals too, men are really bad about it, trying to lift too heavy of a weight and totally losing their form. And they maybe women have maybe just starting out in a gym, maybe don't have that idea of what a proper form or technique looks like. And then injury occurs. So it's, you mentioned, corrective exercise, in your website. I wonder if you can expand on that a little bit.
So corrective exercise is making sure that our body is in the right plane of motion and that we're breathing correctly, that we're lifting for the right style of our body. So, if you have a low back injury and really bad back pain, maybe, in the lumbar spine, you have compressed disc and decay, a deadlift might not be the right thing for you. So really looking at how can we utilize our body and use those muscles without injuring or putting pressure on that area. So kind of looking at all the exercises that we could do instead of something that might put pressure on it or aggravate that muscle or joint.
Yeah.
It's our foundation. You need a sturdy foundation. And if you don't have that, then things get wonky in there. You've got a building like the Leaning Tower of Pisa. So.
Yeah. And this kind of plays in the factor that, okay, let's say we've got a postmenopausal female or male for that matter that has osteoporosis. And they may have heard, okay, well, I don't want to lift anything heavy. I don't want to do this activity because I'm going to hurt myself, or I'm going to fracture, have a compression fracture of my spine, or I'm going to fracture a hip. That's a slippery slope for those types of individuals on how do you can initiate a program for them and still keep them safe.
Right. And really, they should seek out a professional, somebody who knows, has a lot of knowledge around osteopenia, even starting. Because even in osteopenia, there's a lot of things that I modify for clients that, I'm like, well, yeah, you could do this, but also this is going to give us just as much for our money, and it's going to put less pressure, less on your spine. So let's look at doing something like that. So really, if you're in that boat where you have osteoporosis, you have the diagnosis, you've got pain and, maybe osteoarthritis with it, making sure that you have somebody who knows what they're doing. Don't just go to the gym and try, I applaud people who go and they try to do it, but also we don't want to create injury. We don't want to compound what's going on. So making sure that we're finding somebody who really knows what to do. And we do still need, with the right guidance, we do still need to lift weights, and we do still need to walk and do things that are going to be building our bones, because that decay, it's so hard to reverse.
It's not going to go away.
Yeah. So we need to build the muscles around it to protect us.
Absolutely.
Yeah.
How do you know when someone is pushing too hard, or I guess conversely, not enough?
Yes. So Are they feeling fatigued during the last set? That's something that I kind of look at. So if they're not feeling fatigued, they're not feeling like, okay, I just did a workout, then maybe do a little bit harder. Usually I check in with them the next day, see if they have DOMS, delayed onset muscle soreness, like 24 hours after. If not, then it's like, okay, we need to go a little bit higher. Now, if you can't sit on the toilet or get up out of a chair, then that would have gone too far. So, kind of, if you're starting out kind of slow, then you will know, okay, I need to build up a little bit more. It's the times whenever people come in and they're like so gung-ho and excited, and then they can't move for 3 days. Mark, like you said,
Yep.
yeah, you couldn't feed yourself. That sets people back. They don't want to do that over and over. And they're like, oh, working out just makes me feel terrible. We don't want that. Like, you want to hit that range where you're feeling, okay, I worked out, but not, I can't move.
Exactly.
Yeah. And putting in the right foods so that you feel, and hydration so that, you're getting all of the benefits, the good sleep, all of that stuff plays into that.
Yeah. So that moves right into another section, which is nutrition.
Oh.
What are your thoughts on, we have talked a lot about protein, and I've heard lots of women say, like, there's more peer pressure for me to eat protein now than I had in high school around drinking.
It's so true. It is. Yeah, but I think it's a good pressure maybe now. I mean, protein's non-negotiable foundation. It's muscles built from amino acids. Amino acids come from protein. So bottom line is we need protein. So whenever you're building muscle, what happens? So as you're doing like any type of muscle building, you're making microscopic damage in your muscle. And then it healing is what builds the muscle. So we need protein to help us repair that muscle. Without it, then the stimulus from training has no material to work with in our body.
Yes.
Yeah. Yeah. And of course, the daily recommendations for protein intake are way underrated.
Yes.
We always tend to really, I'm sorry?
What would you suggest? Like, what are you?
Yeah, we almost always, with individuals that come in here, anywhere from 0.8 to a full gram of protein per pound of ideal body weight. And, ideal is the key word there, because you may have somebody that's 50 pounds overweight or 100 pounds overweight. And so those individuals can't eat enough protein during the day to take care of that. But the issue that I always try to tell people is that if you don't meet your daily protein requirements of that 0.8 to 1 gram, you don't gain it back.
Yeah.
What you had today, if you only had a half a gram of protein, then you've lost that. So you're not building that muscle. So, and the thing is that, like you said, if we're not fueling ourselves with these amino acids and protein, then you literally are stealing it from somewhere. Some other form of tissue in your body, particularly muscle, is being robbed to help that other group of muscles. So to fuel everything and keep it all going and keep it all moving in the right forward progress, it needs to be recovered.
Yes.
So I would have, for the clients that you see, how much protein do typically your clients get before they start working with you? Like when they first come in, what do you see?
Sometimes they might be getting, this is terrible, but 20 grams of protein a day. I mean, that low, because we've been taught, protein, which we know protein has more calories. And so they look at it and they're like, oh my gosh, this has 200 calories and this has 600 calories. But, this has 30 grams of protein and this has 2 grams of protein. So, one is just learning how to read a label. People really need to know how to read a label, but knowing, the 0.8 to 1 gram of protein, that's what I recommend. And people, whenever I tell them, I mean, their eyes, I'm sure you guys get this too. It's like, what? That's possible. Impossible.
Yeah. And then if somebody wants to do any type of intermittent fasting, it's like, okay, now it's really hard for me to get that protein in my feeding window. So it's really tough for that. But do you also, what's your take on creatine and like branched chain amino acid supplementation?
Love. I've used creatine. Actually, my stepdad was a bodybuilder whenever I was growing up. And so I've been exposed to creatine for a long time, 40 years. And so I've used it for over a decade personally. And I think a lot of times people get it confused that it's a drug. And it's not a drug. It's so natural. It's so researched. It's so safe. And a lot of times whenever I'm working with people, that's the thing that they're like, oh, that's for big bodybuilders, or, I can't take that. Do I have to have a prescription for that? So I think there's just so many things out there that creatine can do. I mean, it's brain health, it's muscle health, it's, helps with our ATP, all of that is so important. So we've talked about, 5 to 10 grams is great. Would you say for men that would be ample, or do men need a little bit more?
I think it's pretty ample. I mean, if you get somebody that can get 10 grams of creatine in a day, I mean, you're gonna see an improvement no matter what. I mean, the problem is if you don't take it, well, you can't amplify your muscle synthesis. And so it's just anything can help. I mean, it's something's got to be a focus, and it's just something extra a person can do. So if you're going to put forth the effort, if you're going to go into the gym, you're going to do all this activity, why not reward your muscles with something that they can use and make some adaptational changes to help protect you and build muscle?
Yeah, and people can really see the difference once I get them on it. They really do notice how their muscles are looking better, how they're lifting a little bit easier. So
yeah, recovery, just, endurance and recovery also, it makes a big difference for that too.
Yeah.
So speaking of recovery, how do you have your clients recover? What does a recovery day look like?
So recovery day for my clients would be walking, just light movements, maybe a little, on the floor stretching, things like that. And we do, most of my clients, I tell them, like, you could work out 6 days a week as long as you're not working the same muscle groups day after day. Like, you need one day in between to repair, but you really do need one day of recovery for our nervous system, for our body. And that can look like just stretching, or I prefer that they not just sit on the couch for 12 hours and binge,
Sure.
so some active recovery in there, but definitely letting their body have a break,
Yeah.
I think that's important.
Yeah, and I'll be honest with you, I don't know what your take on this is, but I've done yoga before and I should do more, but yoga for me is not a recovery day. That is tough,
Tough. It is.
And so, doing the stretching and the rolling and the movement activities, keeping things flexible and mobile is really a key for recovery. I find a lot of people, for folks, individuals. So
Yeah, include myofascial release, like you said, rolling. Yeah, I mean, that's so important. That could be definitely included in a recovery day. It may not be fun. Recovery doesn't.
Exactly. And I think to speak to your yoga comment, that there are lots of different types of yoga.
there is.
There are harder types of yoga that are definitely not recovery. And then there's, yin yoga that really is more like just stretching and very slow and relaxed. And that would probably be more like a recovery yoga, which you have never done.
No, I've not done that.
Remember earlier?
Okay.
Like on Mark Day.
Right. So tell us what is a realistic expectation for someone starting a fitness program? How long does it really take to see results? Maybe it's different for feeling results and seeing results.
Yeah, I think in 4 weeks, you'll see some results, no doubt. I mean, you'll feel better. Maybe your clothes will start feeling a little bit better. 6 to 8 weeks, something kind of magical seems to happen. I've seen where you start sleeping better and the movements begin to feel natural and you have the habit. And it's just kind of like you're in the rhythm of everything. So that 6 to 8 weeks is definitely, and it's not so much what you're seeing, but it's like, oh, okay, I can do this. I know I can. It's feeling good. I'm not sore as often, that type of things. And then at 3 months, you really feel like the stamina and energy starting to compound. And then by 6 months, other people are noticing, oh my gosh, like your arms, or you look more toned, or things like that. So it's kind of a broad picture, but yeah, I mean, it takes 4 weeks, you'll see changes, but 6 months, others are going to be like, wow, you've been putting in some work in the gym, it looks like.
Yes.
Yeah. And I imagine you probably see some challenges too, that
Mm.
individuals that maybe are on GLP-1s or metformin or long-term statin use, those types of things. Some of those individuals may not see their results or their benefits right away, or it may be very difficult for them to see the results too.
It's true. Yeah. And really, if you're on a GLP-1, making sure that you are doing weightlifting, making sure that you are taking care of your muscles and your bones, because one, in perimenopause and, as a midlife person, you're losing the bone, you're losing the muscle, and then you throw something in that is also taking the muscle and taking the bone. So making sure that you are counteracting that as much as possible, even more important.
Yeah, I would
Right.
agree with that for sure.
Right. Any inspiring transformations that really come off the top of your head that you can remember, a man or a woman that maybe that's like, wow, they really changed night and day? We've had a lot of patients that have been in that boat, but I didn't know if you had anybody that from a story that you could share with the listeners.
Yeah, one person comes to mind pretty quickly. She was referred to me by a dietitian. She had autoimmune issues, knee pain. She had never lifted weights. But she had the drive. She was definitely like, I know I need to do these things. So the first time that we met, I just like to kind of see where people are at. And so I'm like, okay, let's try a plank on your knees. And she's like, oh, I can't do a plank, And she's well, actually she was 48 at the time we started working together. So she was like, no, I can't do that, and I was like, well, let's just see. 10 seconds was her max. And that was great. Like, that's where she was at. She could not do more than 3-pound weights. And we started doing our workouts pretty regularly. And I got a text from her, and she was at a football game, and they were setting down at the bottom, and she had to go up and down the stairs 3 times. And she said she was with other people, and she kept looking back, and she's like, why is it taking you so long? And she realized, she's like, oh my gosh, my stamina, like I'm not even out of breath, and they're way behind me. My knees aren't hurting.
That's so awesome.
So, I mean, that was just a priceless moment that, yeah, for her and me both, because I was like, I've seen you putting in the work. I know how hard it's been, and now she's doing planks on the vibration plate. She can do 30 push-ups. I mean, it's amazing. So,
Oh, that is awesome. I love that.
got it.
Do you have one piece of advice for someone listening right now who wants to start but feels intimidated?
I would say get a buddy. Find a buddy who wants to work out too. Somebody out there is looking for a buddy to work out with.
Yeah.
Or get a trainer, somebody who will help you have accountability, and then learn how to lift safely, and just start. Just start getting it in there, getting it in your routine. Our bodies are amazing. Like, you guys, you can do it. You've got this. That's where you're starting from.
Love that.
Yeah.
And we'll put it in the show notes too, but let the listeners know how they can work with you and get in touch with you if they want to.
Yeah, you can check out my website. It's Heather Hausman. I'm on social media. H2PT is my handle. And then I too have a podcast.
Yeah.
So it's the Second Half Strong Show, and it's wherever you can find podcasts. So
That's amazing.
yeah, I have a lot of online programs. So if somebody's looking to start working out from home, or it feels a little bit safer, I have that. And it's the full thing. It's yoga, weightlifting, body weight, all of that stuff. So, and meditation.
Okay. And you are located in St. Joe, Missouri.
I am just a little north of you guys.
Yeah, not too far at all. And then do you work with clients remotely also?
I do. I do FaceTime with clients and that works pretty well. I kind of like being able to be there and see everything and all of that. But FaceTime works pretty well. So,
Okay, excellent. Well, this has been such a pleasure, Heather. Thank you so much for coming on. I'm sure we'll find another reason to have you back someday soon.
yes, have loved it. Thank you guys so much for having me.